Hi guys, I'm Katie Lewis and I'm going to do my 5-minute lecture on influenza. So an overview and the definition of influenza is that flu is a very contagious respiratory virus caused by influenza viruses that infect the nose, throat, and sometimes infects the lungs. Flu is believed to be spread by tiny droplets transmitted when people that are infected cough, sneeze, or talk. There are very many different strands of the flu as well. What puts people at risk for the flu? So anyone can get the flu. The flu is highly contagious, as I'm sure we all know, but certain medical conditions make people more susceptible to becoming critically ill and having adverse, really bad infections with the flu. This includes people being 65 and over, and also people that are under than 5 years of age tend to have worse reactions to the flu, and people of any age with chronic medical conditions such as asthma, another respiratory condition, diabetes or heart disease, and pregnant women are also susceptible to worse reactions from the flu. So when you're seeing these patients in clinic, 3 questions that are essential for workup are when did the symptoms start? It's always important to know when your patient's symptoms started because the symptoms could look a little bit different depending on how long they've been symptomatic. Another important question is to ask if the patient has been febrile at all, when their last fever was, what their fever was it a low-grade fever? Was it 103 degrees? And have they taken any antipyretics or medications that could impact a fever? And then also any family members that have had these symptoms recently or tested positive for flu just because of how contagious it is and the fact that it is spread through that droplet transmission. When you're looking at these patients with physical exam, the most important components for the physical exam are a fever or a feverish feeling, chills, respiratory symptoms such as a cough, sore throat, and then when you're looking at children with these symptoms, diarrhea and vomiting is particularly common in children, but not necessarily common with adults. So an overview of the most common treatment options for patients with the flu. So the best treatment options for the patients with the flu is just rest and antipyretics. If the patient is having fevers and fever-like symptoms, people can alternate Tylenol and ibuprofen as needed and then push a lot of fluids for these patients. There is Tamiflu. Tamiflu is great for the treatment of like an acute illness that's not very complicated, but the patient has to be more than 2 weeks of age and has to be symptomatic for less than 48 hours. So you really have to catch patients in that first 48-hour window in order for Tamiflu to be effective and Tamiflu to be a good option for these patients. Also, I personally have done clinic in an uninsured clinic, and Tamiflu is very expensive for patients that don't have insurance or maybe have limited resources. So it's definitely important to keep that in mind as well. Some priority teaching components of treatment are, like I said, the importance of rest and adequate fluid intake for the patient to feel better and for symptoms to subside. And if you have a child or if for the patient, if the patient is having a temperature consistently over 102 degrees, you definitely need to call a doctor or go to the emergency room because that's a pretty high fever that shouldn't be consistently coming back and being that high, especially as the virus runs its course in the body. And then it's important to also educate on the fact that the transmission is droplet. So it is important for the patient to stay away from others. It's not always easy if it's a child. It's not always easy if you share common spaces with others. And if possible, clean all the surfaces that the patient comes into contact with before other people will touch those surfaces. So this is my 5-minute lecture on the flu, and it is important because I'm sure we are all going to see a lot of these patients in clinic because it is almost flu season.